David Caldwell. All right. Cystic fibrosis, a disease of defective cellular transport. Hello, everyone, and welcome to my Disease of the Cell Final Project presentation. Today, I'll be discussing cystic fibrosis, also known as CF. This is a genetic disorder that begins with a defect at the cellular level and goes on to affect multiple organs throughout the body. In this presentation, I'll explain the cellular basis of CF, the genetics behind it, the symptoms and organ damage it causes, and the current treatments and research that may one day lead to a cure. Cystic fibrosis is a lifelong genetic disease that affects about 70,000 people worldwide. The disorder mainly impacts the lungs and digestive system, but also affects several other organs. CF is caused by mutations in a single gene called the CFTR gene. This gene normally produces a protein that helps regulate the movement of salt and water across cell membranes. When the protein is defective, mucus in the body becomes thick, sticky, and difficult to clear. This leads to chronic infections, breathing problems, digestive issues, and progressive damage to different organs. Slide 3. Cellular basis of CF. To understand cystic fibrosis, we have to start at the cellular level. The CFTR protein is an ATP-graded chloride channel found on the surface of epithelial cells. These cells line the lungs, the pancreas, intestines, sweat glands, and reproductive tracts. In CF, mutations in the CFTR gene cause the protein to be misfolded, broken, or completely absent. As a result, chloride ions cannot move properly through the cell membrane. When chloride can't leave the cell, water does not follow it. This makes the mucus that normally coats cell surfaces become thick, sticky, and dehydrated. This single cellular defect, faulty ion transport, leads to major symptoms of the disease. Impact on the functions of the cell. This thick mucus affects several important cellular functions. First, it disrupts mucillary clearance, which is the process cells use to move mucus and trap bacteria. Because the mucus is too thick, the cilia can't move it. Second, secretory functions in organs like pancreas and intestines become blocked. Over time, trapped bacteria in the lungs cause chronic infections, inflammation, and permanent scarring. So a single malfunctioning protein leads to a chain reaction that affects entire organ systems. Organ system effects. CF affects multiple organs in very different ways. In the lungs, thick mucus traps bacteria and causes repeated infections which eventually lead to lung damage and respiratory failure. In the pancreas, blocked ducts prevent digestive enzymes from reaching the intestines. Without those enzymes, people with CF can't properly digest food or absorb nutrients. In the liver and intestines, mucus blockage can cause inflammation and digestive problems. In the reproductive system, many males with CF are infertile due to blocked sperm ducts. And in the sweat glands, the CFTR protein can't absorb chloride, so sweat becomes extremely salty. Because CF impacts so many organs, treatment requires a multidisciplinary approach. Symptoms and body function impact. The symptoms of cystic fibrosis reflect these underlying problems. In the lungs, symptoms include chronic coughing, wheezing, shortness of breath, and frequent lung infections. In the digestive symptoms include poor weight gain, malnutrition, and greasy stools due to the lack of digestive enzymes. If untreated, these issues can lead to serious complications like severe lung disease, diabetes, and liver damage. However, with early diagnosis and constant treatment, people with cystic fibrosis can now live much longer and healthier lives than in the past. The genetics of cystic fibrosis. Cystic fibrosis is caused entirely by mutations in the CFTR gene. Located on chromosome 7, the gene contains 27 exons and produces a protein with 1,480 amino acids. More than 2,000 known mutations can cause CF, but the most common is called delta F508, which deletes the amino acid penthyline at position 508. This mutation leads to misfolding of the CFTR protein, causing it to be destroyed before it ever reaches the cell's surface. Genetic testing plays an important role in diagnosing CF and identifying which specific mutations a patient has, because this determines which treatments will work best. Inheritance pattern. Cystic fibrosis follows a classic autosomal recessive inheritance pattern. This means a person must inherit 2 defective copies of the CFTR gene, one from each parent, in order to have the disease. If both parents are carriers, each child has a 25% chance of having CF, a 50% chance of being a carrier, and a 25% chance of not carrying the mutation at all. Carriers have one normal CFTR gene and one defective copy, but they typically have no symptoms because of the inheritance pattern. Genetic counseling is extremely important for families with a history of cystic fibrosis. Epigenetics and environmental factors. Although cystic fibrosis is purely a genetic disease, its severity can be influenced by epigenetic and environmental factors. Epigenetic changes, such as DNA methylation and histone modifications, can affect how much CFTR protein each cell produces. These changes don't alter the DNA sequence, but can make symptoms milder or more severe. Environmental factors also play a major role. For example, exposure to secondhand smoke has been shown to worsen lung damage and speed up the progression of the disease. So while the genetic mutation causes cystic fibrosis, lifestyle and environmental factors strongly influence how the disease develops over time. Diagnosis. Cystic fibrosis can be diagnosed in several ways. The most common test is the sweat chloride test, which measures the amount of salt in a person's sweat. People with CF have unusually high chloride levels. Newborn screening is now performed routinely in many countries, allowing early diagnosis even before symptoms appear. Genetic testing can also be used to confirm CF and identify the specific CFTR mutations. Early diagnosis is crucial because it allows treatments to begin before major organ damages occur. Current treatments. Treatment of the CF focuses on managing symptoms and correcting the underlying protein defect when possible. Symptoms-based treatment include airway clearance therapy to remove mucus, inhaled medications, antibiotics to treat infections, and pancreatic enzyme replacement to improve digestion. The most important breakthrough in recent years is the development of CFTR modulators, such as ivacaftor and the combination drug Trikafta. These medications help certain defective CFTR proteins fold correctly and function more normally. For many patients, modulators dramatically improve lung function and reduce infections and increase life expectancy. Prevention and supportive care. While CF cannot be prevented since it's inherited, complications can be reduced through early detection and supportive care. Avoiding smoke exposure, maintaining good hygiene, receiving routine vaccination, and frequent medical checkups will help protect the lungs. Current research trends. The research landscape for cystic fibrosis is very promising. scientists are working on next generation CFTR modulators that work on more mutation types. Gene therapy approaches that insert a working CFTR gene into cells. mRNA therapy, similar to COVID-19 vaccines. Gene editing technology, including CRISPR, which may eventually correct CFTR mutations directly, and new anti-inflammatory treatments to protect the lungs. These approaches aim not just to treat symptoms, but to address the root cause of the disease. Is a cure on the horizon? Right now, cystic fibrosis does not have a complete cure. However, the progress in treatment over the past decade has been remarkable. CFTR modulators have transformed CF from a fatal childhood disease into a condition many people now live into adulthood and beyond. Gene therapy and gene editing are especially exciting because they offer the possibility of fixing the underlying genetic defect, potentially providing a long-term or permanent cure. While we're not there yet, the rapid pace of research provides real hope for the future. Conclusion. In conclusion, cystic fibrosis is a genetic disease that begins with a single defective protein at the cellular level. This defect leads to thick mucus, chronic infections, digestive problems, and organ damage. Although CF is inherited in an autosomal recessive pattern, both genetics and environmental factors influence how severe the disease becomes. Thanks to modern treatments, especially CFTR modulators, patients now live longer, healthier lives than ever before. And with ongoing advances in gene therapy and CRISPR-based approaches, a true cure may one day be possible. These are my references used throughout the project. All sources are peer-reviewed, primary or secondary scientific articles. And thank you.